How do you think when you see the latest figure of infection today, it's 38, do you feel relieved?
The numbers show the decreasing trend of COVID-19 in the countries, but as we observed in the past that the figure is still varied quite a bit. So to me, I believe that we are having decreasing trend, but don't be surprised if the numbers for tomorrow are going up a little bit again.
Why would it go up? What would be the
I think I believe it's the variation of day by day. The number of it is by technical that they cut the numbers at certain times, that they include the numbers. The testing may be positive, but during the weekend or during the long weekend, the reporting may be a little bit delayed. So that is probably maybe the explanation of the variation of day by days.
And well, are we on the right track in terms of all the measures that being introduced right now, state of emergency and curfew, social distancing? Do you think Thai people have been cooperative enough?
I would like to say that we have so many measures at the same time. Not only the public health measures. When we say public health measure, I would mean that we are trying to detect the case as early as we can, and then going out to investigate all the cases, trying to identify the contact and then follow the contact for 14 days, as much as we can, as complete as we can. There is one measure that we have done recently. Then we have another measures like we try to inform the public. We try to encourage everybody to use the cloth mask. We try to prevent the spread of the disease in the hospital. We encourage every sector, every setting to have alcohol gel available for everybody in public places. And recently we have social distancing measures. So it is the combination of all of the things that we have done recently that I think brought the trend down recently.
Yes, and Dr. Tanarak, with the total number of testing on PCR right now, we heard Dr. Tawisin told us today that it's about 70,000 something. Mm-hmm. Do you think it should be faster in terms of having total testing?
Okay. If you look back, I believe that we have done quite a good job on this, and I think we should give credit to everybody involved. If we go back to the times of around early January, if you could remember, at the beginning of January, we have only 2 laboratories that could perform the test. And the number of the laboratories that can perform the test went up very, very fast. Today, we have the capacity of being able to test more than 20,000 samples per day, going up from just around 100 or 200 in the beginning of January. If you consider that we are still developing countries, and with the capacity that we are trying to expand at this rate, I think everybody should be satisfied on the effort of everybody.
So you don't think we have problems with the scale and the efficiency of the testing?
I believe that everyone involved, not just the Department of Medical Science or universities, even public hospital or public laboratories, they are also trying to do their best as well to help the nation with the capacities.
And what are the situations or what are the factors that we should all be mindful of in terms of helping each other, of preventing ourselves from infection? Right now we know social distancing, work from home, stay at home, and also the policy of curfew. Do you think it's enough?
I think it starts to show the effect recently with the combination of all other factors as well, as I mentioned earlier. For example, the use of face masks in the public places, if we observe, went up quite very rapidly from around 10-20% at early March. Now, if you go out into public places, I believe more than 90% now wearing closed masks. With the combination of all the effort, recently, I think that's helped us with the situation that we are in right now. There are still minor things that we still have to work on, and I would like to mention that some of the things is also measures. Some of the measures, things that we should try to solve is the problem of stigma and discrimination. As we see recently, there were a protest against the patient who has been discharged from the hospital. This is the situation that I would like to say that shouldn't be happen here in Thailand. We should not have too much fear in our heart that make us not using the reason well enough. So if I would like to ask and trying to make everybody understand is that the stigma and discrimination will not solve the problem. It will even make the problem worse. What we should try to do is trying to understand what is going on. The patients who has been discharged from the hospital is safe enough. They should not. I can say with my confidence that they would not spread the disease to the community. We are very well aware of patients when to discharge the patients. When we discharge the patient, we are very confident that he or she will not spread the disease in your community.
We were talking earlier about, you can hear me, right, Dr. Tanarak?
Yes.
Okay. We were talking earlier about the discrimination against people suspected of being infected, right? So this pandemic has been around more than 2 or 3 months now, but it looks like people still have misconception about this pandemic. So what else do you think the government, the authorities should do to educate people so that they will have a better understanding of the issue, and then we can do away with this kind of discrimination, which is quite discouraging?
I agree. I think we should do something about it. And for me, there are so many factors that create fear within the community at the moment. What we are trying to calm the community is the disease is not that severe among certain population, and that is one thing. Although the disease can spread very quickly, but there are several ways that everybody can protect themselves against the disease. That is one thing. And what we are trying to do at the moment is trying to tell everyone that there are the fears into situation, I believe, at the moment. One is fear about who has been infected, and they are trying to push the infected patient away. And number 2 is there are fear of the patient who has been treated and discharged from the hospital coming back to the community. So what we are trying to do is trying to give them fact and trying to give them confidence that we are very confident that in what strategy that we are doing, and trying to educate them about what can be done in certain situations. As I mentioned earlier, we should not be worried about the risk as long as we can manage those risks and reduce those risks to the acceptable level.
Maybe it's up to local authority as well to communicate with the people. And for authorities in Bangkok, it will be difficult, right? Because if you have people on the ground and closer to the communities, they will be in a better position to. So how would you handle this then? Because you need to educate, local authorities first before they can communicate with the local communities on this issue.
Yes, that's a very good idea. In terms of trying to educate people, I think we have to work both at at the central level. With the media and social media. And there's one strategy, and we also have to use the health volunteers or using the local authorities to trying to get into those public and trying to provide them with the right information. So we have to work in different ways in order for us to convey this message to the people who now have fears in their heart.
And Dr. Tanarak, what is the urgent need among medical personnel right now around the country? Because we have heard a lot about shortage of PPE or mask N95. What's the situation?
I would say, with the information that I received this morning, I believe that there are always two parts of the problem or two or three issues. I believe that at the moment we have enough of the PPE for quite some time that we still have in our stock. Second thing is that the management to make this PPE to the place that don't have enough of it is one part. So when we say that certain hospital doesn't have enough PPE, you have to look at the issue closely. I don't want to blame anybody on it. It's probably the hospital that have to be aware of the amount that they have and when they should request for more of the supply. And then at the central level who will manage the stock, they should also try their best to provide those equipment to the hospital that need it. And another issue is about the usage of those limited PPE. I would say that the problem with the supplies of PPE is not just for us, but it is now the problem of the whole world. If you follow the news, during the last weekend, we heard that even for the U.S., the president of the United States ordered the company 3M that he would not allow the company to send
to export,
right, to export the mask or the respirators to any other countries.
Yes.
The shortage of this PPE is now the whole world problem.
Yes.
And so what we should try to do is we should try to use the limited resource the best we can. Now there are so many researchers trying to look at the issue of could we reuse or how could we sterilize the N95 respirators to be able to use it safely. And in the meantime, other recommendation of the use of this PPE is also have to be revised and educate the medical personnel as well.
I believe we are still in this so-called golden period, right? So which direction do you think we are moving toward more now?
I believe the situation is getting better. But at the moment we cannot let our guard down. We should still being at the high alert state.
Okay, on the right track. We're on the right track, but
yes.
need to do a lot more.
Right. Need to do a few things better. On certain front, I think we still have to work on the issue very well. For example, when I'm talking about we try to inform certain we try to inform the population. We still believe that certain segments of the population did not really receive our message very well. We believe that the message go to the probably middle class of the population very well, but other population, we may not have good enough strategy or good enough means to convey the message to other segment of the population. So I still think that we still have to work very hard on educate those end of the people.
And Dr. Tanarak, the only hope we can have right now to end this pandemic, is it the vaccine?
Yes. Yes. Not just vaccine, I think, probably other kind of treatment as well. Recently, there were several institutions or several research institutes trying to test other medicines to treat this COVID-19. For the treatment front, I still believe that it will come earlier than the vaccine. At this time, we may have a hope on certain drugs. We know that favipiravir is one of our hope. The second drugs that may be available, result of the research may be available in the next few weeks. That is remdesivir from Gilead. They said that probably the result should be out by the end of April or early May. And other medicine as well that we are still hoping to hear from the result very soon. On the vaccine front, recently there are more than 35 research institutes, including vaccine company, that trying to test their vaccine. A few of them has been in clinical trial in human space or stage. So the WHO has recently announced that probably if everything goes very well, we should be expecting the result of those vaccine trials within 1 year or 1.5 years.
So there's light at the end of the tunnel.
Yes, hopefully.
Okay.
Yeah, so it's about 1 year or 1.5 years. So we all have to keep fingers crossed.